My name is Tahir Ali. I'm the PA. Welcome you and start the program. And I'd like to introduce you to the president of Appne, Dr. Yousaf Shaikh. And Dr. Yousaf Shaikh, you can take it from here. Thank you.
Thank you, Tahir Saab. Assalamu alaikum. Welcome everyone. This is our first webinar of the year 2022. When the pandemic started, we did multiple webinars last year and in 2020. Hopefully, with the end of the pandemic, we can look forward to meeting in person, and instead of webinars, we can have more seminars. We are already planning 2 seminars in the month of May, and I would, see if people can join us in those seminars. So, but today we would like to do our first webinar of the year, and Dr. Batool Kazim is our first panelist, and followed by Dr. Talal Khan. I would like to introduce Dr. Batool Kazim. Dr. Kazim is the staff psychiatrist at the U.S. Bureau of Prisons, where she serves as the Federal Women's Programs Manager with Affirmative Employment Program. Dr. Kazim received her MBBS degree from Punjab University in Lahore, Pakistan. She did her internship in psychiatry at the Beth Israel Medical Center in New York and her residency at UMass Medical Center in Worcester, Massachusetts. She serves as an instructor of psychiatry at Harvard Med School and assistant professor of psychiatry at UMass. And she was also an attending psychiatrist at Worcester State Hospital and Carson Center for Adults and Family in Marlborough Hospital. She also served in MGH River Healthcare Center. Dr. Kazim is a member of the International Society for Sports Psychiatrists, Association of Physicians of Pakistani Descent of North America, and the American Psychiatry Association. She was appointed chair of the American Psychiatric Association Physician Wellbeing and Burnout Committee in May of 2020 to 2021, and she also continued to serve on the member of the committee. She also served as an educator and counselor in a number of community roles, including supporting disaster relief efforts, raising awareness of mental health and peak performance in life, sports, and domestic violence. Our second panelist is Dr. Talal Khan. Dr. Talal Khan is a board certified internist specializing in obesity medicine, preventive medicine, and care, chronic disease management at the Personal Primary Care in Springfield, Massachusetts. He did his medical degree from Rawalpindi Medical College in Rawalpindi, Pakistan, and completed the residency at SUNY in Brooklyn, New York. And Dr. Khan is has a staff privileges at Bay State Medical Center and Mercy Medical Center in Springfield, Massachusetts. Dr. Khan believes that lifestyle changes and healthy choices are crucial to helping his patients manage their chronic illness, lose weight, and avoid future complication. It is his holistic and functional approach to medicine that drives his practice. Dr. Khan has always been passionate about primary care. He practiced in rural Maine for 5 years, and he took care of patients of all walks of life, including Harvard professors to lobster fishermen. And after that, he came to Massachusetts in Western Mass, where he has been in practice for more than 10 years. When Dr. Khan is not seeing his patients, he enjoys time spending outdoor with his wife and 3 children. So I welcome Dr. Kazim. Dr. Kazim, you can take over from here.
Okay. First of all, Assalamu alaikum, and I want to thank Dr. Yousaf and the Appne board for inviting me. And I want to thank everybody who is going to be joining us today, to taking this time out of your busy Sunday to join us. This we'll try to make this as very much more interactive, and I won't bore you for too long. Let me pull up my slideshow. Okay, so we can go to the next slide. I do not have any financial disclosures. And then the next slide. Okay, so we're going to talk about why are we here today? We are talking about the, we are going through we've gone through the pandemic. We are going to be coming out of this. So we're going to be talking about some stress and what is stress, and getting everybody on the same page about what we are talking about. What is wellness? We are talking about that, and why I am talking about this. A little bit of what you need to know. We all need to know what is stress, how it affects the rest of our body and our functioning. Some resources about what we can do about it, and some resources for you to work through, and then hopefully getting to a relaxation exercise, which will be a guided imagery. And I'm going to make sure that we stay in time. Next slide, please. So what is wellness when we talk about this? It includes our physical, our mental, our spiritual, emotional, social, and environmental. So it's like it's the choices we make, the lifestyle we live, and it's a holistic health. It's a complete person who we are, and that's wellness, not just taking one and two parts. Next slide, please. Okay, so the next thing we're going to talk about is resilience. That is the capacity to recover quickly from difficulties, and that shows like mental toughness that we're going to work towards. It's the ability of a substance or object to spring back into shape. Now, we have all had like 2 years of our lives have been turned around. Life is not going to be the same as it was before the pandemic. And as we start to emerge, we are going to be seeing there's a lot of changes that have happened. Life is not the same. And how do we come up strong and, prevail over this? So that's what I'm going to be focusing on. Next, please. So what is stress? So in the dictionary, it says stress is a state of mental or emotional strain or tension resulting from adverse or very demanding circumstances. There is a concept of fight and flight response that was identified over 100 years ago by Dr. Walter Buchanan of Harvard Medical School. It essentially, when we talk about stress, it's not a bad thing. We need stress. It's a survival mechanism in the fight and flight response. So a threat happens to us, it's our ability to fight it off. The problem happens is when it becomes sustained and chronically elevated, and we will see what happens there. Next, please. So just to understand the neurobiology of stress, I want you to think about what, I don't know if I can make the pointer. Can you see my pointer?
No.
Okay. Okay, so we have a prefrontal cortex, which is sitting right here. This part of the brain does all the planning and all the executive functions. Today we have to do this, I have to wear this. All of that thinking takes place right here in the frontal lobe. So we want to divide up to make it very simple, because I know some people who are non-medical folks are going to be joining in. So we basically have two parts of our brain. One is a voluntary part of our brain where we have control over it. And then the other is a involuntary part of our brain, which we don't have control over. That contains, our heart rate and our blood pressure and our breathing and stuff. And that is really deep inside, like here. The thing to remember, where the stress response is initiated, is this little position is called the amygdala. And that's the fear response center in our brain. So when we go further, talk about, please keep this image, this brain picture in mind when we talk about this. Next, please. So what happens, and I'm going to try to make it like really simple. So when we have, our body reacts with the outside environment through our sight, our sound, our taste, our touch, and the smell, the 5 senses. So say there is a threat. So say we go out somewhere and we see a bear, example, big bear. And immediately our body is going to say, oh my God, I might die. So what tends to happen is you are fearful. So either you will freeze or brain will say, okay, let me run out of here. And all of a sudden, before even we know it, our amygdala, fear response center, has kicked in. What it does, it senses the threat, it sends these chemicals into our body, and adrenaline, noradrenaline gets pumped into the blood, and we have increased heart rate, increased muscle tension. So we can fight off a stronger foe. We can run and get away to a safe place. So this is what happens is when there's a threat that happened, the amygdala tells the other brain structure, there's sweaty palm, we are scared. And the process, before we know, we are afraid. So now what happens is that the voluntary part of the brain kicks in and they say, oh, that is a bear. I better get out of this place before he kills me. So you start running. And at that point, the brain will tell you to keep moving, keep running, keep doing until you come to a safe place. And when you get to a safe place, you're inside, you will lock the doors. Then the brain, prefrontal cortex, will send the message to the amygdala. Okay, take a chill, slow down. You are safe. The bear can't get me. The door is locked. Take a deep breath, and we start to come down from all that excited state, which we needed. Okay. All right. Everybody with me so far? Okay, so next slide. All right, so this is a little schematic diagram to show that amygdala, when it gets a threat, there's three processes happen when the amygdala is triggered. First of all, it sends the stress hormones to the body. And what that results in is we have a faster pulse, we are breathing shallower, our blood pressure goes up, muscle tension goes up. We are able to get away from a dangerous situation. At the same time, the amygdala puts it in the hippocampus, which is a memory center. So it puts it in the memory and stores it for future. And then the message also goes to the prefrontal cortex. Oh, this is the threat. This is what happened. What do we do next? So the prefrontal cortex will have the final response. It will either say, okay, now you're safe. You can take a chill, or it can say, no, you're not safe yet. Keep running, don't stop, get to a safe place. Now, how that becomes really important is to say 3 months later, 6 months later, the same person, you forget what happened and you go back to the same area where you encountered the bear. Now, when you're close there, you've forgotten you saw the bear, but all of a sudden you're getting this uneasy feeling. You get a gut feeling about somebody, a person, a dangerous situation, a dangerous place. Always, always, always trust your gut feeling, because guess what is that? That was the amygdala. It was sending a reminder. And the reminder is like, my heart is racing, I'm feeling sweaty palms, I'm feeling a little uneasy. What is this? Remember that, because all of a sudden your cognition will say, oh my God, this is where I ran into a bear. I was lucky last time, I may not be this lucky, so get out of there. So you see how the amygdala is such a protective mechanism. Now let's go to the next one. Next slide, please. Okay. So I'm trying to explain the neurobiology of stress. When we understand how our brain and our body works, then we have more of a sense of control. The involuntary part of the brain is called the autonomic nervous system. It's automatic. We don't have control over it. There are two parts of it. One is the on switch, which is a sympathetic nervous system, which we need, which is what triggered us into that response of increased heart rate, increased blood pressure, increased muscle, for us to target all these outside threat environment. And then when everything gets calm, you're in a safe place, is the off switch, which is a parasympathetic nervous system. And what this does, it does all the opposite of the sympathetic. It calms you down, it lowers the blood pressure, lowers everything, and messages, okay, take a chill. Now, when we are living in an environment where there was a pandemic, there was this uncertainty, there was a fear. And one of the things I say that we are Appne, we are the doctors group, but it's also, it's been equalizing. Whether you're a doctor for 50 years or 5 years, or you're a non-doctor, we're all affected by the same thing. We didn't know anything about COVID when it actually happened, because we've never had a pandemic in our lifetimes. So we were all in the same boat, the fear, unknowing, afraid. Doctors were afraid of bringing COVID back home. I know I was doing the same thing, just making, changing the clothes right in the outside bathroom, making sure it gets washed, because we just didn't know. That fear that we've been living with, and being in close proximity, not getting out, change, what has that done is it has thrown our sympathetic nervous system into overdrive. And when it is in hyperdrive, our first thing that takes place is that the cortisol and other chemicals are given out, because there is nothing happening to take the pressure off or to calm down, because we are always afraid. In the last 2 years, it's been so difficult. So what happens, the secondary chemicals come out, which is like cortisol. And one of the first things that cortisol does is it lowers the immune system. So increased stress, lowered immune system. And this is the time when we all need to have a robust immune system to fight this pandemic. It's going to keep changing. COVID is not going away. It's going to keep mutating, changing, but we have to be ready. Vaccines have been really helpful, but in order to really prevail, we need to have a very strong, robust immune system. And for that, we need to learn stress management. And that is the reason why we are emphasizing on the stress management skills. Okay, I hope everybody is with me so far. Next, please. So what happens when the stress levels are chronically elevated? There's no give, there's no calming down, no relaxing, and which was happening in the pandemic. So our heart rate stays up. We start to get increased blood pressure. Respiratory rate is shallow, rapid, increased muscle tension, diminished blood flow, perspiration, we are sweaty, increased metabolism and blood sugar. Okay, this one for the stress management is the biggest issue. When we are in hyper excitable stage, we have to be responding to the outside environment. Our body switches the metabolism and makes us insulin resistant. So all of a sudden we start to gain weight. It's not that we are eating too much or not exercising, and that weight gain happens in the belly, right in the middle. That's where we don't need it. Okay, so everybody in the COVID has gained 15, 20 pounds. And it's not that and people are beating themselves about it. Oh, I'm lazy. Yes, we're not going out as much, but that weight gain will then lead to other issues, right? Okay, here's the suppression of the immune system. We don't want lowered immune system. And all parts of the body affected. Your lack of focus. People have sleeping problems. They have, relationships are affected and GI issues. Okay, next, please. This is a slide that I took from one of my colleagues, Dr. Farah Basi. She is at Michigan State University. She runs all the Muslim Mental Health Conference. And I just thought this was so important, relevant to us. On top of the pandemic, on top of us, everybody being stressed, now we are immigrants and our children. And how does that further impact? So the impact of the toxic stress, like she says, is that intense and persistent stress can influence how the brain develops, intensifying negative emotions such as fear, impacting learning and memory. It can impact the health by increasing blood pressure. This is what we talked about, causing inflammation in the body. And this part, I use this slide because this is really important. Discrimination is linked to higher rates of smoking, alcohol use, drug use, and unhealthful eating habits. This is a fact of life. We are dealing with that, right? And then the mothers who reported experiencing of racism are more likely to have babies with a low birth weight. And I thought this was like really significant and affects our community. Really important for us to keep in mind. Next, please. All right, so how do we manage the stress? Sure, we have the pandemic. Sure, we have life happens. Sure, we have everything. What do we do? And I think the one take-home message, if you do take away today, is that we forget to activate our off switch. Remember we talked about the on and the off switch? The off switch does the opposites. And we are good about putting on the on switch. We are not good about paying attention to the off switch. When we are managing the stress, everything that I'm going to talk to you about, that the skills and the techniques and all research that shows that what helps with the stress management is just two things. One is aerobic exercise and the other is meditation. So we'll come into that. And why are they important? Because they activate our off switch. So we have to remember we are not immune, even as physicians. We're not immune. We're going to get COVID. We're going to get stress. We're going to get anxiety. It's important to understand our own response to stress. When something happens, how do we respond? How did we respond in the past? And can we change that? We only have control over ourselves. Outside environments happen to us. It's how we respond to it is what will determine how damage is going to cause us in different parts. We need to use strategies that have worked for ourselves and others in the past. Doing some sports, going out, meeting with friends. Now, that is also limited with the COVID, but Zoom has really, helped with that. So whatever had helped you when you were younger, growing up, maybe going for a run, maybe listening to music, maybe doing some meditation, maybe doing prayer, maybe reading the Quran, whatever brings you the relaxation and calmness, everybody is very individual. We should regularly be processing the experiences with our family members. You have somebody had an interaction outside, come and talk about it rather than keep quiet and then taking it out on the family members or getting short-tempered. Adopting healthy habits, adequate sleep. I can't stress more about the adequate sleep, exercising regularly, having a healthy diet, regular health checks. Next, please. We're going to come to the fun part. This is all the background. So it's very, very important to keep a balance and between the professional life and our personal life. It's really, really important. That's the only way we are going to sustain and prevail and be successful through the pandemic. And that means every family member, everybody, the children, the dad, the mom, the grandparents, we all have to be sort of appreciative of each other and work together. Next, please. Okay, so now the question comes in. Okay, we have stress. Okay, we have all of this. And some people could say, oh, what can we do about this? And very interestingly, I'm going to talk to you about why exercise. When they say, okay, go exercise, why is it important? You don't have to go to a gym. You can do the aerobic, you can do exercise right in your own homes. And why is that important? And I'm going to tell you that this is counterproductive. People say, oh, I'm too tired to go to the gym. Oh, I don't have the time to exercise. And I will tell you why it becomes important. Okay, next slide, please. So what happens with the exercise, and it is fascinating research in the last 5-10 years that we are listening, that there's actually new brain cells can develop. For those of us who went to med school like 30 years ago, we used to believe that, your liver and your hair, skin and hair can regrow, but organs like your heart and the brain, once it got damaged, it was damaged. We just have a lot of the brain that we don't use. But the exciting thing now is that new brain cells can be regenerated. And I'll just talk in the next slide about how what is the evidence for that. So exercising, it will enhance the mood, and it's one of the best antidepressant. It's one of the best anti-anxiety. So if you will notice, as a psychiatrist, I haven't talked about the medications right now, and the medications is not the solution. There are so many other things in the holistic approach that, yes, medications have a role when everything, it is not working. They always have a role. The nice thing about aerobic exercise, it helps the ability to learn and process new information. So for children, doing a little bit of aerobic exercise and then learning, they're going to retain that and they're going to learn that, remember that much better. It helps us to think clearly. And the next slide, please. Actually, this diagram that we showed about the workout, so our brain is like a muscle. When people who build up their muscles, they work it out, and then they have the protein shakes, and that's how the muscles bulk up. This is how our brain, we don't use it enough. The more we use it, the stronger and the bigger it is going to get stronger. So we mentioned something called neuroplasticity. So what is that? All of this stuff, you can look it up, you can Google this and find out, but I just wanted to bring it to people's attention. It really is the process of new brain cells developing, new connections developing in new blood vessels. And the neuroplasticity is really stimulated, improved by a protein in the body called the brain-derived neurotrophic factor. And it's very interesting. It is produced by our brain during aerobic exercise. Okay, next, please. So what is brain-derived neurotrophic factor? So in research, they found that when we are exercising and we have to raise your heart rate between 120 and 140 for a sustained period of about 30 minutes, and this could be done doing exercises at home. You can put on some music and do some bhangra. Whatever you're doing, you're moving. The movement is what is necessary. So when you raise your heart rate, and that is what's going to release this BDNF. Now, at the moment, there is no synthetic BDNF that we know of. Eventually, somebody is going to develop that, and it's going to cost a lot of money. And people are just going to sit, on their couch and just want to pop a pill of BDNF. But right now, the only way we can get that is through aerobic exercise. It helps to strengthen new connections. And if there has been damage happened from strokes or trauma or drugs or mental illness, it actually can be regenerated. And we can overcome that. Next, please. Okay, so that was one thing. What can we do? Aerobic exercise and why that is important. And the other thing is a very interesting concept called Shinrin Yoku. And I was looking it up. What is this? What are people doing around the world? So this is a studies happening in Japan, and they did 15-year studies, and you can Google it and you can look this up. It essentially is called forest bathing, spending time in green spaces. We know it's nice to walk around, but do we make the time to take half an hour, or on the weekend, let's take the children and let's just walk in a park where there are trees. So what they're finding is that they, okay, can we go to the next slide? No, actually, let's go back. I missed a slide where it shows all the benefits that the forest bathing. They find that the trees communicate with each other. They send these chemicals in the air and connections to underground. When we are walking among the trees, doing nothing, just walking around in the trees. So the studies, they showed, they checked people's heart rate, blood pressure, all the vitals before they walked into this green space. And they checked their salivary amylase and cortisol levels. They had them go walk. They're doing nothing but just walking. After about half an hour, 40 minutes, when they come out from the other side, they check their vitals. All of their parameters have gone down. That's the parasympathetic, the off switch. It's been calmed down, its blood pressure is down, heart rate is down, and people's all cortisol level, all of those chemicals have come down. So this is one of the other things that you can do. The next thing, next slide, please. So this is a called, so we're going to do actually a very short exercise in relaxation response. So this is a concept, this was developed, and a lot of research is going on in this. What it does is that when we are consciously doing our deep breathing, meditation, and focusing on the moment, on the present, not worrying about what we have to worry about 5 minutes ago, not worrying about what we have to do half an hour from now, just in the moment, just taking the breath, showing some gratitude, appreciating everything that we have, just that momentary taking a break. And for a lot of us, doing our prayers is doing exactly that, taking 5 minutes out of our busy day, spending that momentarily, and then going back our day. So what that does, just that little break, meditation, it's going to slow the heart rate, lower the blood pressure, slow your breathing rate, improve digestion, maintain normal blood sugar levels, reduce stress hormones, increase muscle. Look at all of these. Don't want to go into all of this, but this is all that we are seeing. So this is basically the three things that take home messages, what we can do actively starting today when we are done with this webinar, what you can actually start to do with the families, with each other. You can do the next one, please. Okay, so here I'm going to ask a few minutes I'm going to take, and we're going to actually do a guided imagery. What I want everybody to do is to think about, you're going to close your eyes and you're going to think about having a balloon, pick a color of a balloon, put everything that you've been dealing with in that balloon and everything that you have to do after this 5 minutes, put it in a balloon and imagine that it is just floating from the top of your head. It's attached with a string to the top of your head. It's not going anywhere. When we are done with these 5 minutes, please take your balloons, because I don't want anybody's balloons. Put it out there, and as you close your eyes, you're going to take a deep cleansing breath and exhale slowly. And as you exhale, just imagine all the tension, all the negativity is leaving your body, just going into the chair. And with your next deep breath, you exhale, and in your mind's eye, I want you to imagine that you are going to take a little trip up a small little mountain side. And on the top of this winding path, there is a little cabin. And in that cabin, there is somebody who's your spiritual guide, somebody that you miss, somebody who really appreciates you, you love them, they're waiting for you. I'm going to run this through very quickly, just so people can experience it. It usually takes a longer time to really benefit. As you take the trip up, I want you to paint a picture of what you're seeing around you in the sky. Is there blue sky? Are there green trees? Are there leaves? Are there flowers? Are there fruit trees hanging? As you make your way up, see what the sounds you are hearing. Is there a waterfall? Maybe there are birds chirping, maybe your favorite music. And as you're halfway up, imagine, what are you smelling? Is your favorite food coming down? It's cooking? Is it your favorite fragrance that you can smell? And then pay attention, and you're going up all this time. Pay attention to how you're feeling. Is there a light breeze? Is there a warm breeze? Whatever is most relaxing to you. And then I want you to pay attention to what you're drinking. Maybe you have a favorite lemonade. I want you to think, imagine taking a sip, holding it in your mouth, just appreciating, savor the taste, and then see yourself gulping it down. Now you're at the top of the clearing at the mountain, small little path, and you see this person standing in a little cabin waiting for you. That anxious, that excitement to see this person who's as happy to see you, and you make those steps, you walk up to this person, you embrace. What an amazing time. This is your happy place. Everything that you painted a picture, what you saw, what you hear, what you smell, what you taste, what you felt, and see yourself talking to this person. Talk about any problems that you are having, talk it out, and then take a few breaths, picture, keep this picture, hold this in your mind, and then you start to say your goodbyes as all good things come to an end. You're going to say your goodbyes, and you're going to make plans to come visit as many times whenever you need to get away from the present moment, saying your goodbyes. There's a sadness, but there's also this blessing, this appreciation that this is available to you. And then you make your steps back, and at your own pace, take the steps back, turn around, capture that image in your mind, and you can always come back. This is your happy place. Nobody can take this from you. As you make your winding trip back, the return trip seems very fast. And then you come down, and as you will notice, you feel very, very blessed, very light, very calm. And you open your eyes, and you are ready to deal with any problems that you are having, anything that was bothering. But this time, your heart rate is slowed down, your muscles are relaxed, and you've just been to a very happy place. This technique is going to help you going to sleep. This technique is going to help you anytime that you're feeling overwhelmed, because when we are in calm, we can take care of everything else. And now we'll go to my last slide. And some of the take home points. My favorite thing to say is, the word stress spelled backwards is called desserts. How much do we have cravings to have sweet things when we are stressed? That's what we grab for. It's really important to be mindful of our own needs and limitations. There's an empty cup analogy. If we are feeling depleted, we can't help anybody else. And the reason our devotion to high standards for work leads to our stress and burnout. We come into the fields, whether it is, you're a doctor, you're a nurse, you're a social worker, you're a teacher, even as parents, we think about others, we don't think about ourselves. It's very, very important to take the time and take care of ourselves and fill up our own cup. We need good coping skills. We need to seek professional help when needed. All of this is great, but if we're starting to experience a lot of depression, a lot of suicidality, a lot of anger, family issues, then go seek professional help. And medications do have a role to play at that point. So we need to practice what we preach, what we tell our children. We first have to do it ourselves. We want to activate our off switch, nurture our spirituality, and we practice gratitude. And thank you very much. I hope I haven't taken all the time for Dr. Talal, and we'll have questions at the end of it. Thank you very much for your time.
Thank you, Dr. Batool. Thank you. Dr. Talal, you want to go ahead with the...
Yeah, hi, my name is Talal Khan. I'm just going to acknowledge that you guys can all hear me, right? I'm an internist. I practice in Springfield, Massachusetts. And my practice is based on wellness and some of the skills that Dr. Batool told us about. I would like to thank Appne, the platform, for making this happen. The enormous efforts that these two guys, especially Saud and Yousaf, that I've been seeing for years do, I'm very grateful. And for this great guided meditation that Dr. Kazim just did with us, which actually has put me in a very relaxed state. My talk is about fighting burnout. Let's go to the next slide. So I was one of those physicians who felt a little bit injured, a little bit burnt out by life and some of the stresses of practicing in the United States. And I found out that self-care is important and that I couldn't really wait for somebody to take care of me. I had to do it myself. And so that's what I have based our practice on. And I would start with the central part of fighting burnout and preventing physical, mental, and spiritual injury is to recognize that the best asset for yourself is you. And instead of waiting for someone to come to your rescue, you must rise and take control of your most important asset, which is your health. Once an individual is healthy and happy, she's more likely to be able to contribute meaningfully at a personal, family, organizational, and societal level, which has been recognized by organizations. And that's why you see, whether it's medicine or any other field, emphasis on decreasing burnout and employee wellness. Physical and mental health always go hand in hand. And it is okay to love yourself. Next slide. So I'm just going to kind of talk about, my slide is very, as I would say, common sense and practical. And some of the things that I'm going to touch are different elements of wellness, and one of them is nutrition. There are a lot of fad diets out there, paleo, this and that, and first we used to say don't eat butter, now we say butter is good. I'm just going to say, you got to stop dieting, you got to start living. Eat clean, don't eat processed or junk food. Eat organic, watch your portions. Grow vegetables, go out there, go garden. It's therapeutic. Shop local. Find a local store where you get your groceries from. Cook your own food and increase your knowledge on nutrition. Read books about it, stuff like that. Next slide. Food is medicine. I strongly believe that most of the stuff and chronic disease is preventable. And if you eat clean, food is going to heal you. Next slide. Exercise. Dr. Batool touched on that. Exercise, neuroplasticity is real. Exercise has many benefits. What I've learned practically to do is, our lives are busy. Some of the steps that I've taken myself and I advocate to my patients are show up. You got to be consistent. There are new things in the market. There is Peloton, there's the mirror. You could work out inside the home. So there is really no excuse. You have to be consistent. You can start small. You can set up goals. It's important to set up goals and chase your goals. And one of the most important thing is to compete with yourself. You need to be a better version of yourself every day and try to better yourself. There are things like trackables that we all use with Apple Watch, now doing EKGs and measuring pulse ox, and there's much more on the home exercise equipment and apps industry. So use that. Next slide. Movement, motion is lotion, as this lady is doing, just walking down or up the steps. Next slide. One of the fundamental things of wellness is resting and rejuvenation, and deep sleep is essential for anybody's wellness, but sleep needs a routine. And most of these days with electricity and with the smart gadgets and stuff, we have somehow lost track of sleep. We're busy on our smart devices all the time. We have to unplug. We have to find time to get into a routine. We have to match our beat with Earth's rhythm. So sunrise to sunset. There's some good books out there. One of my favorites is a 5 a.m. rule, in which the author explains the importance of rising up early and really enjoying that time. And then, some patients or people or, all of us can benefit from a sleep ritual where just before you go to bed, the room temperature is 68, maybe you've taken a shower, maybe you have, plugged off your devices, and maybe you're into herbal teas and you do something like that, and you sleep in a dark room and go to sleep. Next slide. Yeah, sleep like a baby. Next slide. Get social. The social connection is integral to you know, we are very social animals, and you know, we forget that. And you know, make and rejuvenate old relationships. Email an old friend. Find time. Make time for friendships. Invest time and energy into making meaningful and loving relationships. Forgive often. Lower your expectations. You know, there are a lot of clubs out there now. Join a club. Join a fitness club. Get out there and move. Next slide. Do something together, maybe an activity, maybe go kayaking with your wife, or you know, go biking with your friends. Next slide. Find God. You know, I think that God, or or search for those who believe in a metaphysical presence is fundamental to our wellness. And so I would like, you know, to give the message to feed your spiritual appetite. Learn to connect with God, whichever means you use. Deepen that relationship through meditation, prayer, and fasting. There is a big, you know, push towards intermittent fasting now. Spend time alone with God, like Dr. Batool was saying. Go into those woods, feel those trees, hug those trees, find your God, and connect with Him. Regularly visit your mosque, your church, your synagogue, your places of worship. Next slide. So search for divinity. Next slide. Outdoors, you know, to me, getting outdoors is critical. Those of us who live in Western Massachusetts, sorry, not Western, in New England, we're pretty lucky because there is a lot of places where you could quickly go into the woods. So connecting with Mother Nature is easier. You know, when I was a little kid, my grandmother always used to ask me to go barefooted on morning dew in the grass. And you know, that hit home. And now there is a whole movement of grounding and how to connect with earth and connecting with those trees and stuff. So pick up an outdoor hobby. There's plenty to choose from. Kayak, hike, climb, ride, swim, but just go out and do that. Next slide. Yeah, you know, we become adults and we forget that there's a kid inside all of us. Life's a playground. Go out and play like a kid. Next slide. Then heal your gut. Microbiome is kind of, you know, a new thing that we have a lot of emphasis on how there's a fingerprint to our gut, the bacteria that live in our gut. And we change them by eating clean, moving often, by, you know, dental cleaning, having pre and probiotics, hydration, by avoiding sugar, alcohol, carbonated drinks, drink water at room temperature, eat fiber, you know, eat yogurt, and feed that flora of a good microbiome. Next slide. Water your inner garden. Let these bacteria, the good bacteria, thrive because they have a fascinating role. And you could spend hours on how the microbiome and the bacteria can decrease anxiety, decrease stress, and make you healthy. Next slide. Supplement wisely. Yeah, I do believe that the topsoil has changed, and there are certain supplements that you might benefit from. I listed some here. I don't want you to become a supplement junkie, but maybe vitamin D, for example, is very important. And also find out the sources of vitamins. Just don't take everything made in China. The vitamins, where they are made, are of fundamental importance. So so do some research before you pick up and decide what you're going to put in your body. Next slide. Love much. I think love is extremely important. Love yourself, love your spouse, love your children, love your neighbor, and then it kind of translates into loving your community. Next slide. There's great power of love. I deeply love my daughter. So this is not me, but this is a good picture of a father with a daughter. Next slide. Laughter. You know, the laugh often. Have a smile on your. Smile at life, be optimistic, you know, laugh alone, laugh at someone. Laughter can be infectious and pass it on. Next slide. So this is a good example of somebody who's bringing warmth with smiling. Next slide. And then the most important thing is to be mindful. The most important thing that I feel in self-care is to do all of these things that I've told you mindfully. Mindfulness is kind of just like Dr. Batool did this exercise with us, was to slow down, get that parasympathetic system growing, and let the sympathetic system rest. And then be mindful, when you eat, you're eating an omelet, try to find that black pepper there. When you're sleeping, sleep mindfully. When you're praying, pray harder and just try to connect with that divine, with divinity or God. Drink mindfully, move mindfully, talk mindfully. And mindfulness is a fun, again, a huge topic right there. But slowing down everything, especially in our rushed society, could be useful. Next slide. Life is a game of chess, so just be mindful. And I think my last slide is after this. Next slide. So this is just kind of like, basically showing my daughter on top of Mount Tom, which is a small mountain here in Western Massachusetts. And it's connecting the love, the going out in nature, the playing around that has helped heal me and heal the burnout that I was feeling after, and help get some self-care going. So that's my presentation, and I hope all of us can learn a little bit from it and use these tools to be well.
Thank you. Very nice.
Thank you, Dr. Talal, and thank you, Dr. Batool Khan. So we will start the questions now. So again, we have a audience can unmute themselves, and ask questions directly. I think that would be fine. If they want to type, that will be fine too. So you can type questions in the chat forum or ask directly. Both are acceptable methods. So I think while people are thinking about questions, Dr. Khadija Chaudhary. Yeah, please, Dr. Khadija, you can go ahead, unmute yourself. And Dr. Khadija is a gastroenterologist in the Lay Clinic. So, she deals with those microbiome problems with the gut. So please go ahead.
Thank you so much for that introduction. What a lovely presentation. And definitely, I believe that you are what you eat. Your microbiome comes from what you put in your mouth. So that can't be emphasized enough. But I also happen to be one of the wellness champions here at Leahy, and I'm part of a team that advocates and provides resources for wellness at my institution. What our presenters have said is very, very relevant. But the challenge that I had myself when I was trying to navigate my own journey of wellness is that you can have all the resources. Maybe a lot of us already know what was said today, but the challenge remains how to find time to do these things. So I would like to hear what the speakers have to say about that. But my 2 cents on that are that when I was struggling to find the time, I, of course, read numerous books on time management. And then from every book, I had a little bit of takeaway. But one thing that I did was I started tracking my time. Where am I spending my time every day? Why am I not finding that 5 minutes for the meditation? And as a result, I identified gaps in my timetable, which were there, but I was not identifying because I was so possessed by the idea that I'm just working. So find the time, it's there, and then incorporate wellness when you find that time gaps on your schedule. But I would like to hear what others have to say about the shortage of time that we have in our lives to incorporate wellness. Thank you again.
So I can go ahead and try to answer this. I think there's a misconception. People think that self-care is the same as being selfish. I hear that all the time. People say, if I'm working all day, if I go home, if I go to the gym, I feel taking away time from my family. So it's not synonymous. If we don't care for ourselves, it's going to lead to the burnout where the cynicism comes in. Your quality of care, your own quality of relationships are going to be affected. So I think having priorities and making yourself a priority is, I think, the first thing. When going for exercise or for a walk, you can take your kid with you. You're like Dr. Talal said, do something together with your spouse. Making that as an effort. Let's go for a walk before we have dinner. Let's just put on some music and let's do some movement, some dance, maybe some bhangra, something. But it's really making a priority. And And you're right. We have the the time. We just don't find. We have to make a date with ourselves. Another thing that I find really important when I've worked in private practice, and I've had a lot of physicians as my patients. One of the things that as a female, I envy men's brains. They're able to compartmentalize much better. So if a male doctor has had an argument with the wife at home or something, they are able to go to work and just not even think about it. So us as mothers, as women physicians, we can't block that out. So what I did for myself, remembering is I tell myself, my patients will get another doctor. May not be as good as me, but they will get taken care of. My children don't have a choice of a mother. And that becomes a boundary for me where I will say no. I think we are not good about saying no. We will keep on doing more and more and more. And that is when our own resources get used up. And that leads to burnout. I hope that answered your question.
It sure did. Thank you so much.
You're very welcome.
While other people can ask questions, I just wanted to have one question for Batool Kazim, that about that chronic stress. You I think briefly touched upon the consequences of chronic stressful situation in the body, which increases this imbalance in the insulin. So we want to pay more, if you can talk more about, because as medicine doctor, we deal with the patients who are chronically stressed, and I see them, they have developed diabetes and high blood pressure, but I'm not sure how commonly you see in your practice.
Oh, it's very common. Mental health and physical health go hand in hand. When I'm treating my patients, most of the antipsychotics, most of their medications just cause metabolic syndrome. And so people's cholesterol goes up. So it is all of our jobs to make sure we're looking at the person as a whole, the patient, not just dealing with our specialty area. And that goes true for us ourselves also. We're not immune. We get high blood pressure, we get strokes, we get cancers, we get anxiety. So the stress management and I believe in more prevention and changing the lifestyle and right early for ourselves. And it has to be a family. It has to be everybody involved. It can't be one person trying to lose weight, one person trying to change their lifestyle. It has to be done together, and that will mean more success. And even for our patients, I will tell them, it's my business. If you're smoking, yes, I'm a psychiatrist. It's my business to talk to you about smoking. It's my business when you gain weight. If I give you a medication and you gain 20 pounds, it is my problem. So we have to, prevent that. So yes, having conversations is really important. Providing education, just simplifying the issue, like the neurobiology of stress, right? How anxiety, and how depression and how PTSD, that analogy of the neurobiology of stress is what also explains what PTSD is. So when people understand why they're reacting a certain way, why are they getting angry at a certain person, or they want to be assaultive to somebody or whatever, it's the amygdala triggering something about something. So something from the past that they're reacting. So it's all about providing a lot of education to our patients. And unfortunately, sometimes we don't have that time in the real world, right, with the managed care, but we still have to find ways.
Yeah, sure. Thank you. Thank you.
You're welcome.
Anybody else has any questions for the panelists?
Yeah, I have, this is Javed. I have one comment and one question. So the comment regarding Dr. Khatija's initial question was that we also noticed, I'm a hospitalist by profession, work in inpatient medicine, that finding difficulty in terms of how to incorporate this in your daily life. And what we have done in our hospital or like in our practice, along with the residencies, that we do mindfulness sessions after every patient discussion. So what we have done is that if we're doing morning rounds, we have we talk about like 10 to 12 patients. So after every patient, then we choose one method of mindfulness for that day. And everybody, all the patients, the residents and the students can have different method. For example, we can focus on the deep breathing for 30 seconds. We can choose that or do that between every patient that we discuss in the room. And then we have like some basic videos that we go over to make sure everybody's on the same page. But I think, and even if I'm rounding without the resident, then I can simply sometimes choose to do a different kind of mindfulness, like either the breathing exercise or feeling your feet and stuff like that before going into every patient room. Just before knocking at the door, I can just like simply close my eyes, 30 seconds, breathe in and out, and then go into the room after that. That will like help me back to bring to the real life. So, and my question is more in terms of the prayer, like we pray 5 times a day, and then how to use mindfulness more effectively in terms of in the prayer to have a better connection with the God. And I know Dr. Talal also mentioned a little bit in terms of like connection with the God, and then Dr. Batool also mentioned in terms of like the prayer being the source of relaxation, and the mindfulness also like how to incorporate it better.
This is very interesting, if I may answer. So I was also finding, we start to do a project, we start to see a patient, and then we get distracted by different things. Our children are studying and then they get distracted. So I adopted this from the yoga practice, if you've done yoga. So one of the teachers had said this exercise about putting a balloon and picking a color and putting everything in. I find that so helpful, and I help my children, and it's helped them. Okay, next half hour you have a test you're studying for. Next half hour, you give yourself this time. Don't worry about, we are focusing mindful, and then take your balloon. And then you're not getting procrastinating. You're not getting distracted. You focus, and it's a skill, just like any other skill. The more we practice, the better we're going to get at it. Not to live, because we only have control over today, just now, present. We don't have control over yesterday. We don't know what tomorrow is going to be. It's just now. And what we do just now is going to impact what happens tomorrow. And so the only control we have is today, just now. We can learn from the past. So this helps me also to focus in the prayer time. So I will tell myself, okay, these next 10 minutes, I'm not going to worry that I have to do laundry, that, something is on the stove or something else I have to answer. So just giving ourselves that permission for that time is, I think, really helps. Because then I can do a good job and feel that, okay, I've accomplished, and not have guilt feeling that I didn't give my best. I hope that answers your question, Dr. Saud. And I think in closing, I do want to say this is a real problem, physician burnout. We have 400 physicians commit suicide every year. And these were the pre-COVID numbers. With COVID, things have just escalated. A lot of people are quitting medicine. People are taking early retirements. People are going part-time because now they're not, they're getting overwhelmed. Their own health is getting affected. So this is a really important topic, and not just for physicians, but it's for everybody else. So I just did want to throw that out.
Sure. I just want to point out 2 physicians, 2 psychiatrists in the audience, Dr. Muhammad Munir and Dr. Parveen Rathod. So if they want to say something, share their experience with the patients or something, please feel free to unmute yourself and say something,
I have a question that you mentioned, Dr. Batool, that you mentioned that you need to do aerobic exercise in order to get that protein BD. And is there another way to get that protein, or do you have to keep on exercising to get that? Is there a medicine that can be prescribed for that, or you're stuck to your treadmill?
Not yet, but all of these relaxation, eating healthy and stuff, this is all will help in releasing the BDNF. But right now, that's what's going to get it. You're going to get it, and eventually somebody is going to develop a synthetic BDNF. Yeah, sorry for the bad news. You do have to exercise.
No, we can stick to our treadmill. That's okay.
Yes.
We also have Dr. Zaida Khwaja in the audience. She's a retired gynecologist. She was the president of the Fatma Jinnah Alumni Association, and she's doing a lot of charity work nowadays. So Dr. Khwaj, if you want to unmute yourself, you want to share your experience, please feel free to do that too anytime.
And I just want to say, I'm so honored that she's here. I know Dr. Zaida from when I was in medical school, and I used to go to their home, and her husband used to assist in his surgery. So
Yeah.
Auntie, I'm very happy she was able to attend today.
Yeah. Yeah, she lives here now. I think she moved to the US now. Yeah. Sure, go ahead, Dr. Praveen.
Okay, well, thank you so much for Dr. Thanks so much, Dr. Batool and Dr. Khan. I really enjoyed your presentations, and they were very helpful things. I don't know what's wrong with my voice, so I'll just...
So there's nothing wrong with the voice. What is happening is you have your iPhone and also your laptop open at the same time. So if you move away from the laptop, you'll be okay. You'll be okay.
Okay.
Okay, now we lost you, Parveen.
Okay. I think I just wanted to say something about Dr. Khan mentioned, the eating healthy and buying local thing, those are also some important points to help yourself, help the community, help yourself. Very, very practical, again, there's a lot of propaganda about certain kind of diets, which not all of them have been found to be beneficial. But if you eat simple, stay local and eat healthy, cook yourself, I think those are also practical, ways to stay healthy and, mentally and physically both. So that's a very important points, But people try to find quick solutions, so they go to these diets and which are not healthy, unfortunately. Okay.
I think Dr. Munir has a question.
Sure, please, Dr. Munir, please go ahead. Yeah.
Assalamu alaikum, everybody. I just want, the two things when the panelist mentioned, I want to just make a comment about the stress and also about the time management. As far as the stress is concerned, this is a part of the life. We cannot help the way we feel. Okay, but the key is how to manage those stresses. The feelings are just going to come. Just doesn't matter if you want it or not. Okay, the coping with those feelings is going to be key. If we don't manage those stresses appropriately, believe me, they will come out one way or another. Okay, sometime in the form of different kind of anxiety or the depression, or maybe major depressive disorder, or anything. It all depends on our inner the chemical imbalance, or get the gift from our parents in the form of the gene and things like that. But we have to deal. So we need to feel comfortable. We need to feel comfortable talking about what we are going through, and it need to be in an inappropriate way. So there are several studies regarding emotional difficulties, that's including the stresses and things like that, and impact on the physical health. There are several studies that more than 50% of the visits to the primary care physicians, like for headache or high blood pressure or some back pain or all those kind of things, is all related to the underlying emotional difficulties. And it's not that they are pretending. It's not that they are pretending that they have a high blood pressure or back pain or something like that. It's because there are something is going on in their lives, and they're not able to get some help appropriately, and they can end up having those physical problems, and that's why they have to go to primary care physician. That's why I want I do talk to my internist or my PCP colleagues. It is easier for the physician to get some help from their primary care PCPs, even for some, for medications for depression or anxiety or for whatever, as compared to for them to go to see a psychiatrist. So I think that if we need to, it's important that we need to let our community or even our non-psychiatrists know that it's okay, to treat them. I can tell you one other thing that it will help us to understand impact of mental illness on our day-to-day life. Do you know that if someone has a major depression or bipolar disorder or any kind of mental illness, even in the severe anxiety, it is very, very difficult for them to get the life insurance as compared to when you have just the diabetes or high blood pressure or even HIV. So as you know, that the denial is quite prevalent and the robust in the, not only in our community, in all over the world, to get help for their emotional difficulty as compared to get help for the medical issues. So I'd like to get some comment from the folks and see what they think about this.
Thank you very much for your comments. I think if you were here for the early part of my presentation, we talked about wellness incorporates the physical, the mental, the spiritual, and everything. So yes, absolutely, it's really important. It goes hand in hand. We can't separate out between mental and physical. And many times mental illness, when it's not talked about, not recognized, it will present as physical issues. And we also talked about why that would be happening.
Right. And the second thing about the time management, I think that as far as we don't take this seriously, as far as spending the time with our friend or with our family or something like that, as compared to the time we spend in our day-to-day work. We have the schedule, we have, the patient we're going to have to see every 15 minutes or half hour, or we have to have this meeting, and we schedule everything accordingly, right? I think that we need to do the same thing when we spend time with our family, right? At least that's time is for our family. I obviously we all going through that difficulties, but I started doing this, okay? That this is the time, at least that's time for them, and that's how I'm going to do it. I'm not going to schedule anything during that time, or the meetings or the patients or anything else. So that become a lot much more manageable than just scheduling the time for non-family situation or no friends or other social situation, and it can be done. We are doing it for everything else, so why we cannot do it for this purpose?
Correct. Yeah, absolutely.
I agree with you. Yes.
Yeah, we need to have self-care, and sometimes we need to learn to say no. Sometimes we get a lot of requests.
Right.
Yeah, so sometimes we need to learn to say no. Right? Aisha, Tahanajib, and Dr. Amna, if you guys wants to say something, if any questions, please feel free to unmute yourself. I'll give you a few more minutes, then we can end the webinar.
And feedback would be really helpful if you people who attended can let us know, what was helpful, what parts we can skip, what we need to do more emphasis on. I think that would be, at least it helps me to be doing it better next time.
I think Aisha, yeah, please go ahead.
Yeah, thank you so much. It was indeed a really nice talk and much helpful topic in this challenging environment. I think everything is challenging, especially being a mother who has just, started the career, struggling with the small kids, managing the household. So it's really, you have to have like a good sense of time management so that you can properly allocate your time between your profession and your family, so that you do not have a guilt at the end of the day that you're not doing much for your own kids who are just like a small kids who needs like a little bit knowledge to how to handle like this challenging environment when they step outside of the home environment, so that they can keep their identity simultaneously. They become effective community like member. So I think so there are a lot of take-home message from these two presentations. And I think so like as a physician, especially physician moms, lot of responsibility lies on us so that we can raise our kids who basically do good in both worlds.
Absolutely.
Yeah, absolutely. Very practical. Yeah. We have to take care of our kids and our families or ourselves. Good. 6:48 p.m. It's a Sunday evening. Tomorrow everybody has to go to work, I believe. So if there's no more questions, I think we can end the talk. If you guys still have questions, please Munir, but everybody else, thank you, Dr. Batool. Thank you, Tahir Saab. Appreciate everybody else coming. Dr. Praveen, Dr. Zaida Khwaja, I think we couldn't hear her, but thanks for coming too. And Dr. Khadija also is always present in our webinar. So thank you for coming too.
And also I want to remind them that this is going to be on YouTube. So if there's any feedback, you can get it on the YouTube and everybody can do that. So as you leave, you can go, as Dr. Talal was saying, you can go hug a tree as long as it's not a poison oak.